work stops at the end of today. So just to give you a little bit of background on what we've been doing in the legislature, the speaker came up with a human trafficking task force, and I was honored to be the vice chair of that. That finished up in December. We got our report out, and we've had 11 bills that we produced out of that task force report. Some of them are good, some of them are phenomenal. But it's one of the things that has been a joy for me is to see some of my colleagues learning about human trafficking. For me, I was in this work before I was elected, so I came in with a lot of knowledge and understanding that it wasn't just like, we see on a TV show or a movie, and understanding the depth of what complex repeat trauma does to a person and does to the people who are engaged in this work as well. And it's been really great to see my colleagues understand this and to understand that with a complex problem like this, that there is no easy fix. We can't just arrest our way out of this issue. And so it really is going to take an all hands on deck approach. We need to make sure that we've got social services involved, the schools involved, nonprofits involved, government involved. I mean, faith communities, everything. Because the problems that we see that lead to human trafficking are the problems that we see that lead to a lot of problems in our world today. And fighting those on an upstream level really is going to, in my opinion, be the solution to what is going to help a lot of people. So, and I think the important thing that I just really want to reinforce with this is that it's about having conversations. It's doing what we're doing today, but it's also about having conversations as we are going on our recess here in a couple of months, as you're seeing people more out in your district. Having those conversations with people and talking to them about what human trafficking looks like, why it's important to you, why we need to pay attention to it, and that we need to find real world solutions to this issue. One of the things that was great about the task force is we had 4 meetings. 2 of them were in Madison, 2 of them are outside of Madison. But one of the things that I was disappointed with is that we didn't have enough people who had lived experience with this issue. We didn't have enough people who'd been personally impacted that were at the table, that were telling their stories. And if we don't have impacted people at the table, we don't have real world solutions. We have theoretical solutions, and we need people who are in a place that have been victimized and exploited. And if they're in a healthy place or they know somebody that has, we need those people to be stepping up and talking and telling their stories. Because we know that those who are closest to the problem are closest to the solution. The other thing that we did not talk about with this task force, and I've been on a couple of statewide task forces, and this seems to be their perpetual problem. And those of you who know me know that I talk about this a bit, is labor trafficking. We really did not deal with the issue of labor trafficking. Our task force was supposed to talk about human trafficking, which is sex trafficking and labor trafficking, and it automatically kind of got narrowed down to child sex trafficking, which is what I've seen in several task forces that we've done in the past. I think obviously stopping all trafficking is important, and child sex trafficking, that's the most vulnerable of the vulnerable. I also think that that's the easiest one for us to highlight and pick off too. I don't know why we never seem to get around to really digging into labor trafficking. I have some theories on that, but I think the more we can talk about that, because labor trafficking is happening all over the world, but it is happening here, and especially in our agricultural areas, especially in our tourism areas, it can be happening. And the more that we are talking to people about what to look for and what to spot, hopefully the more that we are stopping this from happening. So that's another topic that we're going to be dealing with as time goes on, and hopefully getting some really good standards set up. We have the laws in place, but we just need people that are more trained and thinking about it a lot more, because we know with human trafficking, when people are looking for it, they're going to start to see it. And that's why doing things like this and talking about human trafficking and training on human trafficking is so vitally important. And with that, I am going to turn it back over to Senator Johnson to introduce our first panelist. But I just really want to thank everybody for being here today. It's kind of a busy time in the Capitol, and busy time in life, but I appreciate everybody taking time out of their busy day to learn about this and have these conversations. So thank you, LaTanya. LaTanya, you're on mute, dear.
I should know how to use this by now.
It's been a few years, but you know, we all need help, so.
Thank you again, Representative Emerson, and thank you for that introduction. Thank you to all of our panelists for being here. I am just so grateful and so excited for this absolutely awesome symposium and for our panelists today. Our first speaker is going to be Dr. Wendy Ehrman, a renowned adolescent medicine physician with over 3 decades of experience. Dr. Ehrman has dedicated her career to providing care to high-risk youth in Milwaukee and has been actively involved in collaborative efforts with law enforcement, mental health, and community agencies to enhance health care for victims of sex trafficking. She has contributed significantly as a co-investigator on pivotal grants and is a key member of the Milwaukee Anti-Trafficking Task Force. We are honored to have you here with us today, Dr. Ehrman.
Oh, thank you for that introduction. I was asked to give a case, to discuss a case about sex trafficking, but due to HIPAA and confidentiality laws, I'm unable to discuss a specific case. But I am going to instead discuss some of the many risk factors that make a youth vulnerable. But before I do that, I'm going to share my screen because I want to make sure that we're all on the same page with understanding exactly what sex trafficking is and the difference between sex trafficking, the sex trade, and child sex trafficking. This one? I think so. Oops. Okay. Okay. All right. Hopefully everybody can see that now. So this is a Trafficking Victims Protection Law Act of 2000. And this really laid out the definition of what sex trafficking is. It defines sex trafficking as more than just somebody soliciting or basically selling someone for giving a sex act for something of value or money. So anybody that's involved in the act in general, whether they transport somebody, that they provide housing for somebody, they are considered a trafficking. And the key part of this act is the middle part, which is trafficking occurring by threat, force, fraud, or coercion. This is what differentiates sex trafficking from the sex trade. Although I will say the lines can be very blurry when working with survivors. And then the key part is for the purposes of exchanging a sex act or a commercial sex act for something of value. Now, this is different than the definition of child sex trafficking. Child sex trafficking is anything of value that's exchanged for a sex act in a person who's under the age of 18. For child sex trafficking, that whole middle section of force, fraud, and coercion is not required. So even if you have a young person who says, hey, I'm doing this, nobody's forcing me to, it doesn't matter. If they're under the age of 18, they are a victim of sex trafficking. So I'm going to go on to discuss some of the risk factors that make a youth vulnerable for sex trafficking. I'm going to give you some examples of trauma and violence that have been experienced by some of my patients. And I'm going to discuss some of the other issues, medical issues, and other issues that are faced by survivors of sex trafficking. Additionally, if I have time at the end, I hope to share some examples of local projects and community agencies that have been working with survivors and in hopes that they can be used as models for efforts throughout the state. So as mentioned, I've worked with high-risk youth for over 30 years. This includes youth that are in out-of-home placements, meaning youth that are in foster care, residential treatment centers, group homes, and correctional facilities. It wasn't until I was a fellow out of state that I met my first trafficking victim. I didn't know much at the time. And to be honest with you, I really didn't know much until about 10 years later. I had no idea of the extent of the problem, and I had no idea of all of the things that survivors face. My very first survivor was a 17-year-old girl that I saw in my fellowship. I was told from my preceptor that I should not judge her, that I should treat her just like any other patient. And I was a little confused as to why he said that until he told me that she was homeless, she was an IV drug user, she was HIV positive, and she was a juvenile prostitute. In those days, we referred to these young people as juvenile prostitutes, which infers criminality. It's not something that we do anymore because we recognize that these young people are victims and not criminals. Since that time, I've gone on to see a lot more young people that have been involved in trafficking. This young woman, after seeing her, I remember feeling very overwhelmed by her needs and not quite knowing what to do. And I really only saw her once. But since then, I've learned to understand that there are things we can do and that we can knowingly make a difference in the lives of these young people. One thing I wanted to point out is that although we see the media, it often portrays youth who have been involved in trafficking as being kidnapped, forced into trafficking, or smuggled over the border. But this is not typical of the youth that we see. Most of our patients who are sex trafficked are local or from the Wisconsin area, and they have risk factors and social situations that make them very vulnerable to trafficking. Many, and this is a really key point, many of these young people have experienced sexual abuse. Many have experienced multiple, not just sexual abuse, but physical abuse and neglect, and have lived in multiple out-of-home placements and been in correctional facilities. Many of them have become involved through friends, through family, or from people that they have met who promised them things, who've groomed them, which you'll hear a little bit about later, and who've given them things to make them feel wanted, such as money, clothes, jewelry. Many of these youth have been homeless for various reasons, kicked out of their homes, or been runaways. Unfortunately, a number of youth that I've seen over the years have been involved in familial trafficking that was generational. It took me years to recognize this, that I had actually early in my career been seeing young teen moms who had been victims of sex trafficking. And it wasn't until I saw their children much later in life, and I saw their children because they were picked up in trafficking stings or they acknowledged being trafficked, that I realized that it probably was generational and that their parents had also been involved in trafficking. I also had one young girl at age 12 whose father was allegedly a pimp, and that's how she had grown up. One thing to understand about these youth that we see, many of them are very secretive and protective of their relationships, because many of them see their relationships as a romantic relationship, and many of them are willing to protect their trafficker regardless of what they've experienced. Caitlin, who I'm going to introduce next, will talk a little bit about grooming so that you understand kind of what these young people go through that puts them in their situation. Many of these, they've been taught to be secretive, not to talk to police, and they've learned to be street smart. I had one young lady years ago who managed to get herself from one major city to another at age 13. She was streetwise and savvy and knew how to get a ride somewhere up north. And while she was up north, she posed as an older adult. She was eventually taken in by a woman until she was discovered that she was advertising herself on Facebook. When this woman found out she was older and was advertising, she outed this young person on Facebook, which put this person's life at potential danger. So there's other consequences that we see with these young people. Violence is also common among the young people who have experienced trafficking. We've seen youth with black eyes, with bruises, with cuts on their neck. We had, unfortunately, one young lady who had a severe vaginal tear, which had to be surgically repaired. Teens have been pistol whipped, have had guns put to their head, have been grabbed by their hair and thrown across the room. One of my earliest experiences from years ago was with a 12-year-old that had been lured to a party where she had been gang raped. Self-harm is also a common finding that we see in these youth. Self-harm usually consists of cuts, superficial cuts, kind of hide the emotional pain by inflicting physical pain. Many of these youth also carry multiple mental health diagnoses, including things like depression, bipolar disorder, post-traumatic stress disorder, substance abuse. We've even had one patient that we think had dissociative identity disorder, which is a multiple personality disorder. Other things that we commonly see include sexually transmitted infections, pregnancies. I've had 13-year-olds with herpes and 12-year-olds with gonorrhea, patients with syphilis, multiple patients with syphilis. The good news, after all this bad news, is that there are organizations and community agencies that are doing good work out there to improve the treatment of these youth in the community. And we need to do more of this. And these groups and these agencies can be used as role models or can be built upon to improve the efforts across the state. Some of the recommendations, I've read through the list of recommendations and support them and suggest that not only should teachers and social workers and police officers get mandatory training, but it's really important that medical care providers get training too, because sometimes we're some of the first people that see them unknowingly. There needs to be more collaboration among agencies and who can work together instead of duplicating services. And there also needs to be more money for advocates who go out there with these victims and help support them wherever they are. And really quickly, I just wanted to show a couple slides of some agencies that are doing really good work. Oh, you're sharing. Okay. Oops, okay. Sorry, we're just, here we go. Okay, just very quickly, Impact 211 is a repository of resources throughout the state. There's a local 211. Where I'm from, we've created a button here that you can see of human trafficking. And if you push down on that button, it'll drop down and there's a number of different agencies that have expertise or experience in working with trafficking victims. This is something that can be expanded to throughout the state. This is what the drop down looks like. This is some posters and cards that we have that will take people either in medical offices or survivors right to that, that drop down box online. This really quickly is CRAE, which is a grassroots advocacy agency that will go out and meet young people at emergency rooms and urgent care centers when they need an advocate prior to a sexual assault exam. And this is a project I was involved with called HCAST, or Healthcare Collaborative Against Sex Trafficking. It's a website that includes the link to Impact 211 and resources for medical providers and also survivor testimonies. And with that, I'm going to turn this over to my colleague here, Caitlin Michael. Caitlin is a board-certified nurse practitioner who has been practicing for 7 years. All 7 years have been spent working with underserved communities and at-risk populations. Her most recent work has been with vulnerable adolescents, both in a correctional setting and outpatient primary care setting.
Hi there. What I'm going to share with you is my personal view and does not pertain to any one story, but is a blended culmination of stories that I have encountered while working with victims of sexual exploitation or sex trafficking. In my current role, I have the opportunity to provide healthcare to high-risk patients at some of their most vulnerable times. When we talk about high risk, we are referring to patients who have less resources, may experience barriers to healthcare, and are faced with inequities. They sometimes don't attend school regularly. They may have complex living situations, such as living with a relative or a group home, and they may be involved in the legal system. And these different situations can make an individual more vulnerable to being trafficked. A common theme that we many times hear from patients is that their partner buys them nice things. They may be new clothes or phones, maybe cosmetic alterations such as artificial nails, lashes, and hair. This also may include the distribution of illicit substances. Housing and food are also sometimes provided, especially if those are insecurities of the individual. There is also an emotional component that starts early on in the relationship. A friendship is formed in an effort to strengthen the bond. The trafficker is trying to establish trust with the individual. Many times, this is the first step of exploitation before there are other indicators present. What I just described to you can be referred to as grooming. The Oxford Language Dictionary defines grooming as the practice of preparing or training someone for a particular purpose or activity. In terms of sex trafficking and exploitation, the person is building a relationship and trust with the individual as a matter of ultimately gaining control. Many times there is no sexual involvement during this step, and it can be initiated by the trafficker or by another person posing as a friend. If you have the opportunity to speak with a victim, this will many times be the beginning of their story. Anytime that you hear about a person in this position, be aware and pay attention to what they share with you, because there will likely be red flags present in their story. There is a Wisconsin sex trafficking indicator tool that can help with decision-making for reporting purposes. And then I'm just going to share my screen to show you. So this tool lists different high-risk behaviors such as running away, history of sexually transmitted infections, unusual tattoos, reported use of hotels for parties, or reports that the individual has friends or family that are involved in the commercial sex industries. All of these can be indicators or clues that the individual is being trafficked. This tool can also help us with decision-making for reporting purposes. Not all victims will disclose what is going on, and there will be times when you have suspicions that aren't quite confirmed yet. This tool can help during those times and direct you to the next steps. Another piece that I want to discuss is recruitment. Just as someone might be recruited for a sports team or an extracurricular activity, sex traffickers have other teenagers and sometimes older women trying to recruit teenagers into trafficking. This is sometimes incorporated into the grooming process. I've heard several different stories from teenagers being recruited at school, at public events, or even from other girls they may live with at a group home. I also want to note that although I many times refer to sex trafficked individuals using she, her pronouns, all genders are affected by this. So it's important to also screen for trafficking concerns in people other than those who identify as female. From a policy standpoint, there is a continued need for awareness, education, and screening. In my very first position as a nurse practitioner, I did not have this knowledge base. Because of this, I didn't know what questions to ask or how to discuss concerns of trafficking early on in my career. This rapidly changed once I stepped into my current role, and I was quickly made more aware of what sex trafficking is and how I could be an effective advocate for my patients. I believe that there is a need for more education surrounding trafficking for those who are still in training, nursing school, medical school, and training programs for medical assistants and nursing assistants. Training programs should also be mandated for anyone working in the public service industry and the medical fields. If more people are educated and aware of the risk factors or indicators, then we all can make a positive impact in these people's lives.
Thank you so very much, Dr. Ehrman, and thank you, Caitlin, for sharing this information and also for your insight. That information is extremely helpful. And now I would like to introduce our next speaker, Ms. Nancy Yarbrough, a committed social justice activist, victim advocate, and the founder director for Fresh Start Learning Incorporated in Milwaukee. With over 15 years in the field, Nancy's work emphasizes the crucial role of community awareness in combating sex trafficking, along with providing essential services to its victims. Thank you for being here.
Hello. Good. Thank you so very much for having me, Senator Johnson. I was wide open, listening to Dr. Ehrman and Caitlin sharing about those inroads and what it looks like to be submissive to a call that most people think, why did you answer that? Why did you answer that call, right? Today, I wore this shirt called A Life for a Life because it's a program that we created inside of Fresh Start to advise people once you are inside of that exploitive lifestyle, once you are embedded in it, there's some things that need to happen for you to exchange that life for the new life, right? It's not as easy as one would think, and I'm glad that they touched on some of the points that turns this into a two-sided coin. So when Jacob reached out to me, I did advise that I would like to share a little bit more about the two-sided coin from my lived experience and now my learned experience, how I got in, why I stayed in, how I got out, and how I stayed out and helped successfully bring other youth out of this particular situation, as well as young adults, male or female. I remember being a young girl and being very curious about things. And I call this the green light, right? We talk about red flags. I call green flags, yellow flags, and red flags. So you'll hear me kind of refer to them in this way as I talk about my journey for just a moment. I had a naive, open-hearted kind of person that really loved to please people. I was ridiculed as a child. I was bullied as a young girl. So I really didn't know who I was in a space where I should have been able to feel more secure in my body, right? So that was some of the first trauma things that were unresolved in my life. And I always like to tell people unresolved trauma can breed additional trauma being inflicted on you without you even realizing that it's trauma, because what your heart is searching for is for somebody to love you and to belong. I was brought up in a two-family home. We were middle class, so I didn't have the poverty issue, the marginalized lines. I didn't have any of those things that would cause me to say yes to my perpetrator. But what I did have was my green lights were showing and people were able to identify them. I didn't realize that I was in harm's way when people were touching me inappropriately because we never spoke in regards to involuntary body response or an orgasm that you have when people touch you in your lower region. So immediately that was another secret, another trauma that was added. My dad and my mom got a divorce. He was still very prevalent in my life, but he was no longer in the household. So that left me wide open to my brother, which was now the man of the house, that gave me a different outlook on what that should look like for a female and male interaction. My brother wasn't a very good big brother. So then that's another unresolved trauma, still trying to fit into a family that you were born into and trying to find your way and navigate to fill out that love that you needed. My mom, I know she loved me. However, my mom was now a single parent inside of the house, but still had to work. And I was the youngest of four. So it left me to a lot of my own devices. A lot of times hanging out at my cousin's house or going different places got me open up to some of the things that end up happening. Third trauma being a rape, that I didn't desire, didn't want, didn't need, and I didn't like, but I didn't tell anybody. Another unresolved trauma. Started dabbling in marijuana and some drinking at a younger age that I shouldn't have, but that was my coping skills because now I'm hanging around an older crowd. So my inroad was all those unresolved traumas, being innocent, being open, wanting to feel loved and accepted, hadn't experienced a lot of things, and I started normalizing the things that were happening to me based on now my immediate company. So now these older people are pulling me in and I'm hanging out and they're giving me all these accolades and allowing me to feel like I fit in where I really didn't. I was 16 years old and got introduced to cocaine. So I ended up having that experience and got hooked on cocaine, which gave another entry point for now my soon-to-be trafficker, my boyfriend, my boo, my bae. He gave me trust in my heart toward him till he started asking me to now sell myself for money. 17 years old, one child, and already been through tons of trauma. Now I'm entered into this new life where I feel like finally I'm accepted. Nobody's criticizing me. Nobody's ridiculing me. Nobody's making me feel bad. It looks like I fit. I finally found something that I'm good at. Plus the mask or the disguise of the alcohol and drugs that I was underneath, that was altering my mind, because at some point I already knew that things were wrong because I didn't smile about it. I cried on the inside, on the outside. Fast forwarding, to the other part of it, I had a lot of lived experience. Getting out of it was a little bit challenging because now I have to figure out what am I going to do outside of this. I went back to school and got my high school diploma the untraditional way. I'd already have a son at that time. I am now 18. I'm still struggling with relationships. Now I'm outside of, the pimp mentality. Now I have a boyfriend that's using as well. And now he's exploiting me, so I'm getting into all these different nuances of what that means. So when I'm talking to the youth right now that I have the privilege of working with for the last 10 years, it's also a kind of voice that I'm able to hear them and understand. Then now I'm able to speak to them so they get it. This is not the end for you. This is something that's been written in your narrative of your life, that now that you have the pen in your hand, you can start writing in some of those good parts. And I know that it works. Taking time to understand them where they are and not putting a label on them and saying this was an experience, but this is not your life. How do we exchange that? How do we make your life turn something different? By using two words in a better way, not using should, because now I feel like I'm dumb, stupid because I didn't do it, but using could, because it is a way that you can get out of this life and turn it around. Listening to get an understanding and making sure that I understood that people really care for me. My foundation in Christ is what brought me out of the lifestyle and made me stay out for good. I still had challenges. I still had that residue of life, still not loving myself like I should, still involved in domestic situations, which is a fine line in between human trafficking, because you think this relationship is good, but yet it still has some of the nuances of exploitation attached to it. So those things help me to understand that I have to exchange all of this for everything new. Even some people that I were hanging around, some family members I needed to forgiving myself, and then allowing myself to get the necessary help that I needed. Started journaling, learning what my coping skills were. And then moving into that yellow flag that I was talking about is learning how to take precautions, learning how to communicate what I was feeling, declaring that I am hurt, I am angry, and learning my why. So now I teach that forward to our youth that I have the privilege of working with. It's okay for you to be angry, not understand. It's okay for you to cry. It's okay for you not to have an answer to something somebody's asking you. The complexities of being trafficked is not something I can sit down and break open to you at any given point. And I've been out of the life for years. So learning what being cheated on means, cheating on yourself and being cheated on for others, learning what physical abuse was and mental abuse, emotional abuse, and the emotional part is what kept me in the lifestyle the longest, because I didn't know how to untie all the damage that happened to my heart, but not loving myself. So one of the main things I teach our youth is how to be accountable to what you feel and not accepting controlling behavior, and starting to understand what kind of friends you want. It's the kind of friends that'll seek you or you'll seek after. And then in that red flag lifestyle, for me, now the preventive part that I'm already in it, now you got to get me out. Teaching them that the red flags are this. Learning how to put your guards up. Learning how that trust needs to be earned. Is not immediately given. Learning how to ask questions if somebody slips into your DM and starts talking to you about things that's challenging you, asking you to do things that are outside of your comfort zone. You can ask questions, not be open to the advances of people and making them feel like they know more about you than you do. Be careful what you share with people, learning what cautionary things are, and being able now to create programs that actually model this. So we do outreach out on the street where people are learning how to get out of that lifestyle. We do a provisional housing. We connect with collaborative partners. And then I'm always somewhere doing some awareness and prevention and sharing my journey when I get an opportunity to. Learning how to report dangerous situations, learning how to trusted adults in your life. And there's so much more. But I'm so very grateful that we're having this courageous conversation and learning how to unpack it, and not in a way that just checklists, but really how we are right now, and how social media and all those platforms are now taking a deeper dive where we need to go as well, and not be scared to learn the language and what's happening to our youth, and learning that we're stronger together than we are apart, and not work in silos. So thank you, Senator Johnson, for having this panel, allowing us to share our experiences, and hopefully we can work more together on policy changes and to help our community. Thank you.
I just want to say thank you, Nancy, for sharing your story, for your bravery, but also for showing us what can happen when we do what's necessary and make the right investments and allow the necessary resources to flow into these young ladies, and they can become powerful women that not only go on to do great things, but then reach back into the community and help others. And that is exactly what those young ladies grow up to do. They reach back and they help others in ways that only we could only imagine that we could, because they know the life, they've lived the life, and they have so much to give back. So thank you for being that example. And now we are going to transition or shift the focus just a little bit, and we are going to hear from our law enforcement officers and hear their perspectives. Here to share their experience in combating human trafficking are Detective Anna Flores, Officer Mike Walker, and Maria Rozek from the Milwaukee Police Department Sensitive Crimes Division. And it is such an honor to have you guys here, and I look so forward to learning everything that you guys have to share. So thank you for being here.
Thank you for having us, Senator Johnson. And thank you for the speakers that were ahead of us and laying out a good groundwork about what trafficking is and what the challenges are in the community and what a victim looks like in our community. So just a little overview about who we are. We're assigned to human trafficking unit here at the Milwaukee Police Department. We're a small subsection of the Sensitive Crimes Division of the Milwaukee Police Department, which is one of 4 investigative divisions out of the Milwaukee Police Department. Currently, there's 2 of us, myself, Officer Walker, and Detective Flores, formerly Detective O'Donna. And then we have a great advocate, which we could not do any of our work with, is Maria Rozak, who's behind me. So like I said, we're responsible for receiving referrals, going out for calls for service related to trafficking issues as they come and be reported in the city of Milwaukee. Just a little overview. 2022, we had 58 human trafficking cases, which we investigated. 2023, there was a substantial increase to 123, which leads into our focuses as far as challenges, which we were asked to talk about. Although we have a lot of challenges in conducting these investigations, as you can imagine, we're able to highlight at least 3 of them, and 3 of them that we think we can make a significant reduction in trafficking if we had these things would be funding, of course. You won't find a law enforcement agency that is not going to be asking for more funding as far as staffing or equipment and resources. And also something another that's unique that often people don't think about is our ability to take away some of these people who are contributing to the trafficking problem, which is the ability to be able to shame some of these individuals who are victimizing our juveniles and contributing to the trafficking. If you've ever been part of or seen a part of an op that we conduct, we cast a net and we get a lot of individuals, mostly men, out soliciting young women in our community for sex. And when you have contact, when you see it's people from all cross sections of the community, so nobody's excluded. In that we've come across so many people in our community, but ability to maybe post their information to get people to think about before they even start trying to solicit in our high prostitution areas. If we can have that ability, I think we can make a huge reduction. And the other thing is training. As much as we try to get out and train our personnel in our department through in-service trainings, we want to kind of bring more statewide as part of the training that every officer gets in the state as far as educating them on trafficking issues so they're able to identify it while they're out on patrol. And then with that, I'm going to turn it over to Detective Flores.
Hi, everybody. Thank you for having us. I'm going to piggyback on what Mike said. Our numbers, 123, and that's number that was updated on January 9th. That includes charge cases, open investigations, referrals from Bureau of Child Welfare or other agencies or even our officers. Last year, we were able to create a human trafficking dedicated email where if we went to share awareness, if we gave training, if we reached out to agencies, if we came across our officers, we would give out that email to send each and every tip if they come across something. And like Mike said, there's only two of us. We take basically each and every trafficking case that comes through. And we do need more investigators. You know, I would like to tell you how many were here when I got here, and it was more than 5. I can't give the exact number right now, but it's just it's unbelievable. And I know that we have shortages all across the department, but knowing how human trafficking is increasing, and Milwaukee is a hub for trafficking, and we have generational pimps that don't go away. I think there should be more resources. There should be more investigators assigned to do that. So that's when Maria comes in, and we rely on Maria and our other advocates to keep our victims engaged and on board, and so that way we can follow up with them, because obviously we have to prioritize by the deadlines that we have. If we have somebody in custody, like, we can't tend to everybody. We have to focus on what's in front of us, and if it's time sensitive, that's what we do first. That's why we need that engagement from others. Another obstacle is location of group homes. We have 50% of group homes in the state of Wisconsin are within Milwaukee. We have traffickers sitting outside the group homes and down the block, picking up our youth, enticing them, telling, oh, do you want to smoke weed? You need a ride? You need something? And then they're stuck in the situation and they're scared. If we were to move those group homes out of the city, we would see less cases where our youth is being enticed by these men, and they know where the group homes are. And then another thing about the group homes is that some of the places that we know seem more like they're making money, like it's just for a paycheck. Like, we don't see reports of our girls going AWOL or missing for the night. Like, we find out after the fact. Sometimes they don't make the missing reports, so we don't know what to focus on or who to look for because we don't have that information. The number one, I think, issue that we have is that we need a dedicated district attorney to human trafficking cases. We have district attorneys for sensitive crimes, and they're amazing, but these cases require somebody who's aggressive, who knows these investigations are complex, where we are facing issues such as victim credibility, fear, and trauma. Those cases are not easy cases, and they span over sometimes 3-4 years. Those investigations are long investigations, and we need somebody who's going to be aggressive. You know, what was sad to see, I think 2 years back, is that we have DAs who are willing to enter a plea agreement of solicitation of a prostitute, which is awful because it's victim shaming, it's re-traumatizing, it's unbelievable to me that something like that could happen. So we need a DA that would never do that, that they would believe that it would be unethical to do something like that. We talked a little bit about public shaming. Other states conduct operations and they will post on Facebook, for example, booking photos of the men, of the buyers. And I don't know what our limitation is within our state. I know that we have aldermans in the districts who have billboards available for free for us to post those photos. However, we're not being able to because we're being told that there is no conviction, that it's just the arrest. But if we don't stop the buyers, we're not going to stop this because the demand is gonna grow, and we have RNC coming, and then there's DNC in Chicago, and us being right off the freeway, we know that where those highways leads and all the hotels nearby, like, we know the numbers are just going to grow. So without stopping or having a loud message about the consequences, we're not going to be able to stop it. What else? What else? What else?
Just a little bit on the funding part. I think we lack in the technology we need. In a lot of these trafficking cases, our biggest source of evidence is what's on cell phones, either through our victims and through the traffickers. And a lot of times we're able to get consent from our victims to get these phones forensically examined, to get the needed evidence we can to connect them with the trafficker and the money trail and all the things we need to build a solid case. But we don't have the software to do that immediately. And I know I've seen in some operations, both federal and through the state, that we've been able to quickly download cell phone data quickly, so we can quickly get it analyzed and get that phone back to the victim, because we know all of us are going to be lost without our cell phones for a significant amount of time. Currently, the Milwaukee Police Department has 2 people that do the forensic exams, and we have to go through them to do so. And in doing that, it can be up to 30 days that we have these victim phones before, to get them forensically examined and returned back to them, which can be a huge hurdle in explaining that to them and allowing them to get consent and get the evidence that we need. So funding for that, one program is called Cellbrite, that is commonly used for law enforcement. If we could have that here at the Sensitive Crimes Division and Human Trafficking Unit, we can quickly get the evidence we need and continue on with our investigations without being stalled, and able to meet the needs of our victims as well. And then as far as the district attorneys, yes, I'm going to piggyback on what Detective Flores was saying. It's so important to have a dedicated DA, not only for what she said, but also for case management. Okay, to have to represent a new case to a new DA in a charging rotation that's not familiar with maybe a victim that we had last month or last year, or a trafficker we had last month or last year. We have to bring them up to speed on what was going on in those other cases. It'd be nice just to have us all together on the same page and have good case management, so it helps them build their case in court without, again, having this delay of us re-educating them on who these actors are. And then I'm going to turn it over to Maria, because she does a lot of the training through the Law Enforcement Standing Board for the state, and she can talk about some of those obstacles that we have with that.
Good afternoon, everyone. I just want to say that it is for ourselves in this room, but it is a privilege to stand with all of you to try and have a conversation about not only the needs of individuals, but the needs of our citizens in our community and our society as a whole, to try and build a sense of safety. Advocacy for me, I want to say that the Milwaukee Police Department is one of very few law enforcement departments in our state that has an advocate that works in-house. And I am only in sensitive crimes. There's only one me. I'm not full-time. And I am able to stand with people because of not only the dedicated investigators that I have the privilege of working with, but also the commitment of command staff and leadership to ensuring that there's a holding vessel. Because as Officer Walker and Detective Flores said, these cases don't take days or weeks or months. They take years, and they build across time, and people are moving in and out of situations that are not only challenging, but can be life-threatening along the way. And we become this holding vessel. And as a systems-based advocate, I need to ensure that people have a community advocate that's confidential, that they have a sense of connection, that they know that if they drop off for months, that we're not going anywhere. One of the things I can tell you with certainty is our department, our division, this small little team is dedicated to ensuring that when people come to us and start to be at a place of readiness to talk about a wrong thing that happened, that they know that we're not going anywhere if they need to step off for a minute, or if they're not quite sure. There are days that we literally go out in a car on the street and hand out water and hand out coats and fruit snacks and all the things, because we just want people to know that we're here and we care, which is what all of you are here for, right? Like, we are on this panel today because we recognize that there are people that are hurting in our community, and we want to have the ability and the capacity to respond. And it's bigger than two people being able to investigate all the things. Our department is very dedicated to training regarding human trafficking. However, there's limitations to that. If you don't have the capacity to remove officers from the street to have a training, right? We know that a lot of times trafficking is identified through a patrol situation, a traffic stop, something in the tavern district, something happening. So if we don't have the capacity to spend the time and invest in our division, as Detective Flores and Officer Walker said, I'm part of overall training for our department. I'm certified as a law enforcement standard certified trainer, and there is no time dedicated to human trafficking. And the updates needed for that material, like our last update for sexual assault training of recruits, for child maltreatment training of recruits, for training on victims of any type, is from 2014, right? So laws have changed since then. The types of resources available have changed since then. How we network as multidisciplinary teams have changed since then. So that is definitely an area where we can do more. I was at the academy today training with a multidisciplinary team. So members of the district attorney's office training new detectives. In our entire day of 8 hours of training, there is nothing that we have time for related to human trafficking other than to include information about the laws. It's not built into the system yet. So the system is behind, and that's not our department's issue. That's statewide. There are departments that don't even get this training. So we reach out, we do all of the things, but that is definitely an area where, again, as a multidisciplinary team, if we had a dedicated prosecutor that could train with us. I'm doing a law enforcement training countywide in March. I have an hour and a half. A detective is going to have a half hour. I'm going to have a half hour, and maybe a person with lived experience. I can't do that to someone with lived experience, right? I can't say your voice is contained in this piece of time. So we here within the Sensitive Crimes Division, certainly within the Milwaukee Police Department, are not only aware of the needs of the community, we are reaching out and honestly trying to join as many times as we can with our community partners. Senator, as you mentioned before, our faith communities are huge. I have whole churches that create opportunities to shore up people across time. But that time grows longer and longer and longer. And if we can't continue to express systemically to people the impact that this has on individuals. Detective Flores mentioned, we worked with a person for, I think, 3 years now who helped get her trafficker revoked. He's back in custody on a homicide. And at the end of the day, her case was pled out as soliciting a prostitute. And for her to go through years and years and years of cooperating and putting herself at risk and her family at risk and all the things, to be shamed and named that in a public way was, and, you know, to the credit of the Milwaukee County system, she has a victims' rights attorney. They affected change. They spoke and made sure her voice was heard. But she's also a federal victim who is no longer willing to participate in a federal investigation because of what she went through. So you got a team of 3 people in this room, and I'm going to be quiet now because I have lots of words. But really what I want to say to everybody on this panel and everybody listening is, we use the word victim. I don't label people. But what I will say in the criminal justice system is greater victim support really leads to a stronger offender accountability and can build a safer society. And if we can do those 3 things, we're going to see and affect change in the way that I think all of our hearts hope to do. That's all. Thank you, Senator.
Thank you.
Thank you.
No, thank you. A heartfelt thank you to Detective Flores, Officer Walker, and Ms. Rozak. Your stories highlight the challenges law enforcement face and the strides made in supporting victims, but also in the challenges that we need to conquer in order to make sure that we eradicate human trafficking. To hear the training aspect of not being able to, update the training since 2014. These challenges around the state, that's unacceptable. And so more has to be done. And more definitely has to be done in terms of resources, because we know that we have a very small window. Some people think that, we only care about human trafficking when it comes to juveniles. And that's just not the case. But we do know that we have a small window, because when children turn 17, then they're prosecuted as adults. And that goes on their adult records. And so in this building, it's easier to get sympathy for children than it is for adults. But we know that they're victims. Nobody, is born into this world or grows up wanting to be a prostitute. And, everyone comes into that life from a place of trauma, and we have to do better. So thank you for that information. It's invaluable. And for the people who are listening and who need that information, you have done us a world of good. So thank you. And now for our last speaker to conclude our speaker session, we're privileged to have Aisha Jackson. The Anti-Human Trafficking Coordinator at the Department of Children and Families. And I hope that I did not just butcher your name. If I did, please forgive me. And please correct me too. Aisha plays a crucial role in leading statewide initiatives to support at-risk youth and survivors of sex trafficking in Wisconsin. Her background in advocacy and case management for trafficking survivors makes her insight invaluable. So thank you for joining us today. I'm so extremely happy to have you here, and I look forward to hearing what you have to say.
Absolutely. Thank you so much. And thank you all for having me. I am really honored. I have really enjoyed listening to all presenters. I saw some familiar faces. Great to be here with you guys. And yeah, again, just an honor to be here amongst you all. So again, my name is Aisha Jackson. I'm the Anti-Human Trafficking Coordinator at the Department of Children and Families, and I'm centered in the Bureau of Youth Services. So within that bureau, we focus on the needs of older youth who may be engaged in the child welfare system. That does include youth justice. And as a state child welfare agency, our role centers on sex trafficking of children specifically, although here at DCF, we do partner with other state agencies who are engaged in the broader work of human trafficking prevention and response, which does include labor trafficking, as Representative Emerson stated earlier. We know that sex trafficking can happen in any community and to anyone from all backgrounds. However, some populations experience greater vulnerability, as we heard from Dr. Ehrman, who mentioned youth who are experiencing homelessness or youth in out-of-home care placement. But I also want to highlight, again, youth who are in the child welfare system, including youth justice, LGBTQ plus youth, youth of color, particularly Indigenous and Black youth experiencing housing instability, youth who've experienced physical and sexual abuse, and youth with disabilities all experience a higher risk of victimization. Additionally, there are experiences of marginalization, such as poverty, racism, homophobia, and transphobia that also can increase a young person's vulnerability to experiencing trafficking. And traffickers exploit youth by identifying and targeting these vulnerabilities and engage in a series of tactics to gain a young person's trust, just as Caitlin described as grooming earlier. So protective factors such as safe and stable housing, connection to communities, or connection to positive and supportive adults, and ability to have those tangible or emotional needs met can reduce or even prevent a young person's vulnerability to trafficking. And we've heard from everyone else about the needs of young people who've experienced trafficking. So we know that they often require intense case management or coordination of services across multiple systems. So that can include safety planning, advocacy, educational support, mental health services, and job training. And often these are young people that many systems and many agencies are already working with in some capacity, but may not have identified them as experiencing trafficking. So again, cross-agency and cross-system collaboration are crucial to supporting young people who've experienced trafficking. And I'm sure you kind of heard that as a theme throughout everyone's presentations already. We know that it can be challenging to work and support young people who've experienced trafficking for a variety of reasons. They may not see themselves as experiencing trafficking. It's very rare that you'll hear a young person say, or use the term sex trafficking to describe their experience. Youth who've experienced sex trafficking may also have difficulty trusting systems, especially if they received a punitive or a negative response in the past. And this is also true if a young person has had someone who's exploited them, who has let them know that you may receive a punitive response yourself if you seek support. So like you may be arrested or charged with prostitution if you try and tell on me, or if you let a caring adult know what you're experiencing. I'm not going to get in trouble. You are. That sort of thing. So seeing young people through the lens of the traumas that they experience can help us make sense of their responses as we work to support them. I also want to talk a little bit about our efforts here at DCF to address child sex trafficking. So research shows that children and families have better results when they're supported jointly in their homes and in their communities. So our Putting Families First efforts here at DCF are focused on keeping families and children together by serving them in their homes and in their communities with resources and services when possible. And we know that to support children, we must also support their families, and situations involving the sex trafficking of youth, those are no exception. So DCF continues to shift the focus of our anti-human trafficking efforts to better align with this transformation and strategic direction more closely. And we also place an emphasis on supporting the provision of community-based services for young people affected by trafficking. So here at DCF, we currently fund services based in our 7 youth services regions, and they work to provide case coordination and referrals. They provide support groups. Some of our newer grantees and programs provide caregiver support services, multidisciplinary team staffing, and also training to counties and community-based agencies who may be working with young folks who have experienced trafficking. And all of these services have been provided within child advocacy centers, youth justice, outreach and drop-in centers, other youth serving agencies, and also runaway and homeless youth shelters. And these grantees or programs have been instrumental in providing services within the communities and having their ears to the ground at the local level, because we know that a lot of this work is localized. And these anti-human trafficking grantees have also provided a host of trainings that have been open statewide or to their specific service area. And many of these trainings, we've strived to have folks with lived experience and lived experience experts to facilitate these trainings, and those often have been offered virtually and in person. In addition to our anti-human trafficking programs, here at DCF, we also support a variety of youth serving programs, which includes programs for young people who have aged out of foster care, which we know is a vulnerable population, and also our runaway and homeless youth providers. So one of our key strategies has been to increase the ability for these programs to access trainings that would aid in understanding and supporting youth in their program who have experienced trafficking, because we know that these programs are also seeing young people who have experienced trafficking, whether they've been identified or whether they disclosed or not. To better assist with public awareness and professional awareness of trafficking in our state, the Department of Children and Families has created a documentary titled It Happens Here. And It Happens Here tells the true stories of survivors from Wisconsin and throughout Wisconsin, and conveys how easy it is to be drawn into the life and challenges with exiting the life. Survivors featured in this documentary, again, are from all areas of the state, which is purposely done to address the not in my backyard or not in my community mentality, or the belief that trafficking only impacts and happens in urban areas. And again, It Happens Here is part of a statewide effort to inform youth and adults about the risk factors and warning signs of trafficking, and for folks to learn what they can do to assist individuals who have been affected by trafficking. DCF has a long history of collaboration with both the Department of Public Instruction and the Department of Justice, but specifically with the Department of Public Instruction, DPI, and DCF have both created a school-based facilitation guide to assist school-based professionals with facilitating It Happens Here within schools and responding to potential student disclosures and questions. So these trainings have been offered virtually since 2020. We just had our last one last week, actually, for school-based professionals, particularly school social workers, counselors, nurses, school psychologists, to watch the documentary all together and talk more about the issue and what they're seeing in schools. We've continued to respond to these training needs by school-based professionals by adding deeper dives for them as they're seeking more information about child sex trafficking. And the topics that we've done these deeper dives have been included supporting students who've experienced trafficking, safety planning for youth who've experienced trafficking. We have had a training called From App to Exploitation, which talks about that intersection of technology and exploitation. And again, we have also done more facilitations of It Happens Here. These trainings are going to continue throughout the remainder of the school year. Upcoming, we have another round of From App to Exploitation. And we also have a training topic on supporting boys who've experienced exploitation. So we're really looking forward to working with DPI and our school-based partners on more learnings and just responding to their training needs. So as you've heard from everyone, cross-system collaboration is so important as we all continue to address and support young people who've experienced trafficking. I know Nancy mentioned Stronger Together when she spoke, and I know that Representative Emerson also mentioned an all-hands-on-deck approach. And it really is that. It's not just that, you know, our law enforcement partners are the only ones who need to know, or our child welfare partners are the only ones who need to know. We all need to know. And I'm so glad that we had our healthcare professionals here as well to share with us their perspective. And it really is a community effort to making sure that young people stay safe and are protected from exploiters. So that's all I've got for you all. Thank you so much for having me. If you have any questions, feel free to check out It Happens Here on the DCF website as well.
Thank you so much, Asia, for that information and for being here today. Unfortunately, we don't have time for question and answers because we went well above our time for this program. I want to thank all of our panelists, but I also want you to know that if you do have burning questions, my information is going to be put in the chat. So feel free to reach out to my office and we will get those questions to the appropriate panelists to make sure that you do get the answers to your question. Again, thank you to all of our panelists and thank you to you for being here to take this time to educate yourself. It was such a treat today to see so many people here today that are just doing such great work in helping to eradicate human trafficking and that have such a passion for these victims and understanding that, you know, the only way that we are going to make lives better for these victims is if we educate ourselves and if we provide the resources necessary to get these things done. So again, thank you to our panelists and thank you for being here and taking the time to get this education and for making this symposium a success. So thank you, thank you, thank you. And I look forward to seeing you again next year with more information.